Breast surgery, like for breast cancer, can leave behind more than just the physical scars. Edema or swelling caused by lymph fluid or post-surgical swelling can both be a challenging part of the healing process, leaving behind discomfort and pain. My name is Kelly, and I am a certified lymphedema and cancer physical therapist. In this video, I'm going to share my best tips on how to help your body move that lymph fluid and reduce edema and discomfort, both short-term and long-term. So if you or a loved one are dealing with breast surgery recovery, or you have chronic swelling or edema in your chest or breast, then this video is for you. Now first, is your swelling or edema after a surgery harmful, or will it stay around forever? Lymphatic fluid is a crucial part of your immune system, which helps to remove waste and toxins from your body. However, after breast surgery, the natural flow of lymph can be disrupted, which can lead to swelling or edema in the breast or the chest area. The swelling after surgery may also be increased blood flow, which is used for healing. And this type of swelling is very typical, and we call it post-surgical swelling, and it should go away after around 4 to 8 weeks for most individuals, but that may vary a little bit. It can, however, cause discomfort, but it really shouldn't cause any long-term issues. Now, if swelling lingers on for weeks or months longer, then we call this chronic edema, or it may also be lymphedema, which is caused by a dysfunction or the injury to the lymphatic system. Lymphedema doesn't typically go away, but it can be well managed with proper treatment to decrease the swelling and pain. So around 20 to 30% of individuals develop lymphedema after surgery, and those who also have radiation, especially to the lymph node areas around the armpits, may be at a higher risk of getting that long-term or chronic lymphedema. But either way, proper care and support can really make a massive difference in helping with this swelling. So one way to reduce edema is through gentle massage, which we call manual lymphatic drainage. Lymphatic drainage guides fluid from the chest or the breast where it may be congested and towards the lymph nodes in the armpits on both sides, which we call the axillary lymph nodes, or the lymph nodes in the surrounding areas, like around the sternum there are lymph nodes, we call the peristernal nodes, around the collarbones, we call the clavicular nodes, and on occasion even down to the lymph nodes in the groin, which we call the inguinal lymph nodes. So with our full hand, we use gentle strokes, ideally directly on the skin, to guide fluid towards the lymph nodes. At these lymph nodes, the fluid then moves deeper into deeper vessels to get out of that area, and eventually they make its way back to the heart. Now, if someone had lymph nodes removed, we want to focus on guiding that lymph fluid that is congested and pooling and sitting there towards the healthy lymph nodes that may be still there, that were not removed during surgery or not damaged with radiation, or to another area that didn't have the surgery or radiation to help decongest that area. Now, if you want to go step by step and follow along on how to do this, I have a few different videos on my channel for a full routine that you can follow along with. Lymphatic drainage can be done to the whole area, and we want to focus on the areas that someone has congestion. So the majority of people who have breast lymphedema after surgery or radiation tend to have it underneath around the sides. So we may spend some time there specifically, or we may be doing the whole area depending on how much time we have. So again, you can follow along with those routines that you can find on my channel. Lymphatic drainage is most often done daily when someone has swelling or lymphedema, and we combine this with compression and other treatments as well. So another critical element in managing swelling or edema is the use of compression bras or compression garments. Compression works by applying a consistent, gentle pressure to the tissues of the breast or chest. And this pressure helps to push that lymph fluid away from that swollen area and back into the lymphatic system, into the lymphatic vessels, into the lymph nodes, where it can be adequately drained. By doing this, compression reduces swelling, but it can really also prevent that fluid from accumulating in the first place or returning. The sponsor of this video, 𝐿, has a fantastic brand new option for precisely this. 𝐿's Mobiderm Intimate Bra is designed specifically for individuals who are recovering from breast cancer surgery or radiation. This bra provides targeted compression with really great coverage to help reduce swelling and support the healing. With its integrated Mobiderm compression pads, the Mobiderm Intimate Bra applies gentle pressure to the affected areas by edema and can help promote lymph drainage. The Mobiderm compression pad consists of small foam blocks that are between two non-woven fabrics that use a variation in pressure. And this combined that it's very low profile and discreet, and that together creates a very effective therapy. This pressure style encourages lymph flow to move out of that area while also softening any tissues that may have been hardened from scarring, from radiation fibrosis, or from the chronic swelling. As a physical therapist, I think the Mobiderm Intimate Bra is really also a great option for those who have swelling or lymphedema that's on the side of the breast or chest or even into that back area. The Mobiderm pad comes all the way around the side and even into that upper back or side back area. And so a lot of bras aren't giving that coverage, aren't giving that extra support, and this one does. So if you have stubborn swelling that wraps around, this bra is great for you. Again, like I said, it's a really low profile insert. And so with a lot of inserts that you want that extra compression, it's hard for people to want to wear them during the day because they are a little bit more bulky. The Mobiderm pad is really low profile and thin, so it's something that you can still wear discreetly under a lot of clothing and get that support longer during the day versus just having to wear them at night or evening. It's still a great option for night and evening, but again, I think it's a great option for someone can wear throughout the day without noticing that extra bulk with that compression. I also think this is, like I said, it's a good full compression bra. It comes up nice and high, but it's not so high that if you want to wear a little bit of a lower shirt on the top, have a little bit of a lower neckline versus a really high one, this is still going to be low enough that you likely won't see it. So it's really good coverage, but still an in-between if someone's looking for a bra, again, that has the support where you most need it, but is not showing through everything that you wear. And on top of this, I love that this bra is soft, but still compressive. It does have the front fasteners that make it simple to put on and take off. Its straps are wide, and importantly, they are padded for comfort. And it doesn't have any wires or thick seams to make sure that we don't have any tourniquet areas that could make swelling worse. It has integrated pockets inside for breast forms or inserts that someone want to put in the bra, and it comes in 5 different ready-to-wear sizes. The Mobiderm Intimate Bra was developed specifically for breast-related edema, and it's a perfect tool to help reduce swelling and move lymph fluid in the short term and long term. So to learn more about 𝐿's Mobiderm Intimate Bra or to find the product for yourself, you can check out the link in the description box down below. Now lastly, exercise and deep breathing can help move lymph fluid and decrease that swelling. By activating the muscles, especially in the upper body and in the trunk or abdomen region, a pump is created where the muscles will naturally stimulate the lymph vessels to move that fluid. Our lymphatic system relies on movement and muscles to work. So regular movement like walking or stretching are important. Ideally, someone will wear a compression bra like 𝐿's Mobiderm Intimate Bra while exercising because that added compression or support is optimal and supportive for lymphatic fluid flow while you have that muscle pump. And with this, deep breathing during exercise or even at rest will stimulate the larger lymphatic vessels in the chest and the abdomen area to activate, and it's really helpful for moving fluid and lymphatic health overall for the whole body. Swelling and edema in the breast or the chest after surgery or radiation can cause pain, discomfort, and in some cases, it can linger on long-term, like with lymphedema. But again, with proper support and treatment, like with lymphatic drainage, compression, and exercise, one can get rid of edema or manage and reduce it really well. Now, it's always important to speak with your doctor or a certified lymphedema therapist for more individualized guidance and treatment. Still, these are the main treatment options for lymphedema in this area that are important to reduce that swelling, the pain, and other symptoms. If you want to learn more about the 𝐏𝐿 Mobiderm Intimate Bra, again, check out the link in the description box down below. Otherwise, I hope you all found this video helpful, and we'll see you all in the next video. Thanks, everyone.